Okay, assessing newborns and infants. Right. The subsequent infant physical assessment. So we have here are the assessment procedure and the findings, which is the normal findings and the abnormal findings. So sa general appearance and behavior, so yung gagawin nating assessment procedure is observe the general appearance. Observe hygiene, note the interaction with parents and yourself or the siblings if present. Note also faces or facial expression and posture. So, ang titingnan natin yung the abnormal findings. So, the child's appears stated age is clean, has no unusual body odor, the clothing, and the condition and the appropriate for climate. So, titingnan din natin na yung kasama sa normal findings is yung alert, yung active, yung infant, and also yung response appropriately to a stress of the situation. So, yun yung kasama. Sa abnormal findings naman, note any phases that indicate acute illness, respiratory, or distress. So, makikita naman natin yun sa infant. So, kasama rin dito ang flaccidity, or rigidity in newborn may be from neurologic damage, sepsis, or pain. So, yung kasama din yung poor hygiene and yung clothes may indicate neglect or poverty. So, ang sa developmental assessment naman is screen for cognitive language, social and gross and fine motor development. Developmental delays in the beginning of the physical assessment in infants. So, sa normal findings, so infant meets normal parameter for age. Si information ay contained in subjective data section. So, yung gross and fine motor skills then. So, sa abnormal findings, yung mga child lags in earlier stages. So, stages. Okay, the vital signs. So, assess the temperature. So ang yung sa rectal, yung pinaka accurate sa lahat na ano, yung sa rectal, axillary skin, or tympanic root when assessing the temperature of an infant. So, the axillary and or tympanic temperature may also be used. Note apical pulse rate. So, sa normal findings, so dapat yung temperature is 99.4 degrees Fahrenheit because of excess heat production. Awake and resting rates vary with the age of the child. For a newborn to 1-month-old child, it should be 120 to 160 beats per minute. So sa abnormal findings, sa vital signs, temperature may be altered by exercise, stress, crying environment, jaw nerve variation, highest between 4 and 6 p.m. Both hypothermic and hypothermic conditions are noted in infants. Sa pulse naman, pulse may be altered by medication, activity, and pain as well as pathologic condition. So, pag bradycardia is 100 beats per minute in an infant is usually an ominous finding. Sa tachycardia may also indicate cardiac respiratory problems or sepsis. So ito yung the assess respiratory rate and character, measuring respiratory rate and character in infants by observing abdominal movement. So, yung nasa pictures, ito yung kung paano mag-assess ng respiratory rate sa infant. So, sa normal findings, sa neonates, rate is 30 to 60 breaths per minute. So, breathing is unlabeled, lung sounds clear. Newborns are obligatory nose breathers. Sa abnormal findings, so respiratory rate and character may be altered by medication, positioning, fever, and activity, as well as pathologic conditions. Measure respiratory rate and character in infants by observing abdominal movements. So, evaluate infant blood pressure if necessary. So, yun yung sa assessment procedure. Sa normal findings naman, so breathing is unlabored, lungs sound, clear newborns. So, same pa din pa. So, sa measurements naman, so yung assessment procedure is yung measure length. Determine height by measuring the recumbrant length. Fully extend the body, holding the head in midline and gently grasping the knees, pushing them downward until the legs are fully extended and touching the table. So, next is the measure weight naman. So kung kanina sa length naman, so sa kung gaano kahaba yung yung infant, dito naman kung gaano kabigat. Measure weight on an appropriate size beam scale with non-detectable weights. Weight an infant lying or sitting on a scale that measures to the nearest 0.50 or 10 gram. Sa normal findings, for normal okay. Sa abnormal findings is significant deviation from normal in the growth charge. A charge would be considered abnormal. So ito yung nasa picture, so iyan yung mga assessment procedure. So determine the head and chest circumference. Measure head circumference AZ or occipital frontal circumference OFC at every physical examination for infants and toddlers younger than 2 years and older children when conditions warrant. So sa normal findings, measurement should be fall between the 5th and 95th percentiles and should be comparable to the child's height and weight percentiles. So sa abnormal findings naman is abnormal circumference of head include less than 29 centimeter and greater than 34 centimeter. HCOFC not within the normal percentiles may indicate pathology. So sa skin, hair, and nails, assess for skin color, odor, and lesions. So titingnan naman natin yung sa balat, yung kulay ng balat nung infant. So, di ba may mga naninilaw doon. Tapos kung may mga lesions or kung may aboy yung bata. Yung sa normal findings, skin color ranges from pale white with pink. So, yun yung yellow, brown, or olive tones to dark brown or black. So, yun yung normal na color ng bata. So, arteriolysis, sluggish perforation of peripheral circulation may be present. Sa abnormal findings, yellow skin may indicate jaundice or passage of meconium in utero secondary to fetal distress. Jaundice within 24 hours after birth is pathologic and may indicate hemolytic disease of the newborn. Blue skin suggests cyanosis, pallor suggests anemia, and redness suggests fever, irritation. So, sa abnormal skin lesions include cafe oil-like spots if there are 6 or more hyperpigmented macules, greater neurofibromatosis, inherited neurocutaneous disease. The common newborn skin variation include cytologic jaundice, birthmarks, milia, erythema toxicum, telangiectatic nevi, the caveolite then the benign hemangioma, port wine stain, flat macule reddish purple in color noted at birth, which is caused from capillary dilation on the surface of the skin. This usually do not fade over time. Abnormal skin so ito yung sinasabi na mga abnormal findings sa infant. Sa procedure, so inspect and palpate hair, observe for distribution, characteristic and presence of any unusual hair on body. Inspect and palpate nails, note color, texture, shape, and condition of nails. So, a normal finding sa palpates sa hair and the nails is hair is normally lustrous, silky, strong, and elastic. The no-go find downy hair that covers parts of the body such as the shoulders, back, and sacral area may be seen in the newborn or infant. Cultural consideration of African American children usually have that hair is curlier, coarser than Caucasian children. Cultural consideration, dark skin children have deeper nail pigment, nails extend to end of fingers or beyond and are well formed. So sa abnormal findings, dirty, matted hair may indicate neglect. Tufts or hair over spine may indicate spina bifida occulta. Blue nail sa nail naman, blue nail beds indicate cyanosis, yellow nail beds indicate jaundice, blue-black nail bed suggest a nail bed hemorrhage. So, kapag head, neck, and cervical lymph nodes, inspect and palpate the head. Note shape and symmetry in newborns. Inspect and palpate the condition of fontanelles and sutures. Normal findings is head is normocephalic and symmetric. So in newborns, the head may be oddly shaped from molding, overriding of the sutures during vaginal birth. Sa abnormal findings naman, a very large head is found with hydrocephalus. An oddly shaped head is found with premature closure of sutures, possibly genetic. One-sided flattening of the head suggests prolonged positioning on one side. So, ito yung kung paano mag-palpate ng head. And also yung hair. So, ito, sa may sagittal suture. So, yung scalp, the periosteum, the serum, blood, skull, and bone. Sa test head control, head posture, and range of motion. So, isa din niya sa procedure sa infant and also inspect and palpate the face. Note appearance, symmetry, and movement. Palpate the parathyroid glands for swelling. So, titingnan din natin kung nagdudu. Inspect and palpate the neck. Palpate the thyroid gland and trachea. Also inspect and palpate the cervical lymph nodes for swelling, mobility, temperature, and tenderness. Sa normal findings, sa test head control, head posture, and ROM, full range of motion, up, down, and sideways is normal. Infant should have head control by 4 months of age. Face is normally proportionate and symmetric. Movements are equal bilaterally. Parotid glands are normal size. The neck is usually short with skin folds between the head and shoulder during infancy. Sa abnormal findings, hyperretection is seen with opisthotonus or significant meningeal irritation. Limited of motion may indicate torticollis or wry neck. Unusual proportion, short palpebral fissure, thin lips, and wide and flat philtrum, which is groove above the upper lip. Abnormal faces may indicate chromosomal anomaly. So, sa assessment procedure ulit, observe the iris and the pupils, inspect the eyebrows and eyelashes, perform visually acuity test, assess visual acuity by observing infant's ability to gaze at an object. Performing extraocular muscle test, a Heisenberg test, shine light directly at the cornea while the infant looks at the straight ahead. Sa normal findings, typically the iris is blue in light skin infants and brown in dark skin within 9 months. eyebrows should be symmetric in shape and movement. Ang eyelashes naman should be evenly distributed and curled outward. So in the Hirschberg test, the light reflects symmetry in the center of both pupils. So sa abnormal findings, brush-filled spots may indicate Down syndrome, sluggish pupil indicate a neurologic problem, meiosis or constrictions indicate heuristics or narcotic use or abuse. Spareness of eyebrows or lashes could indicate skin disease. Sa assessment procedure, perform ophthalmoscopic examination. So red reflex is present. The reflex rules out the most serious defects of the cornea, aqueous chamber, lens, and vitreous humor. So sa abnormal findings, absence of the red reflex indicate cataracts. Papilledema is unusual in children of this age, owning the ability of the fontanelles and sutures to open during increased intracranial pressure. This blurring and hemorrhages should be reported immediately. So sa ears naman, inspect external ears. Note placement, discharge, or lesions of the ears. So yung normal findings sa ears, top of pinna should cross the eye occiput line and be within a 10% degree angle of a perpendicular line drawn from the occiput to the lobe. No unusual structure or marking should be apparent on the pinna. So sa abnormal, low set ears with a alignment greater than a 10 degree angle suggests retardation or congenital syndromes. Abnormal shape may suggest renal disease, process which may be hereditary. So titingnan din natin yung mga kung may discharge ba yung ears. So yung ears ang next naman kung kanina external, ngayon naman ay internal. The internal ear examination requires an otoscope. The nurse should always hold the otoscope in a manner that allows for rapid removal in the child moves. So sa normal findings, no excessive cerumen, discharge, lesions, exorations, or foreign body in external canal. Amniotic fluid vernix may be present in anal of the ear of the newborn. Tympanic membrane is pearly gray to light pink with normal Lundberg's. Abnormal findings is presence of foreign bodies or cerumen impaction. Purulent discharge may indicate otitis externa or presence of foreign body. So next is hearing acuity in the infant test. Hearing acuity by noting the reaction to noise. Stand approximately 12 inches from the infant and create a loud noise. A newborn will exhibit the startle or moro reflex in blink eyes, acoustic blink reflex in response to noise. Older infant will return head. So kapag normal is no reaction to noise. So in merong a hearing deficit and auditory result outside normal range suggest hearing deficit. So inspect mouth and throat. Note the condition of the lips, palates, tongue, and buccal mucosa. Epstein, spurs, small yellow, white, retention, cyst on the hard palate, and gums are common in newborns and usually disappear in the first week of life. So kapag abnormal findings naman is white discharge noted on the tongue or buccal mucosa is cleft lip, and or palate are congenital abnormalities. Observe the condition of the gums when teeth appear, count teeth, and note location. Note the condition of the throat and tonsils. Also observe the insertion and ending point of the frenulum. Inspect nose and sinuses. To inspect nose and sinuses, avoid using nasal speculum in infant and young children. So ito na yung mga normal findings. Gums appear pink and moist. Teeth may begin erupting at 46 months. Tonsils are not visible in newborns. As the infant gets older, it is possible but still difficult to see tonsils. Nose is midline in face, septum is straight, and nerves are patent. So, abnormal findings naman is abnormal. So, dito yung mga lesion and edema. Extension of the frenulum to the tip of tongue may interfere with extension of the tongue, which causes speech difficulties. So, sa breast naman, inspect and palpate breast, note shape, symmetry, color, tenderness, discharge, lesions, and masses. Normal findings, newborns may have enlarged and engorged breast with a white liquid discharge resulting from influence of maternal hormones. This condition revolves spontaneously within days. Normal findings, a palpable mass of breast is abnormal. The newborn may have a extra nipples noted in the chest or abdomen called supinomerary nipples. So inspect and palpate the precordium. Note lips, apical pulse, apical impulse. Auscultate heart sounds. The apical pulse is at the fourth intercostal space until the age of 7 years. When it drops to the fifth, it also left at the mid-clavicular line MCL until age 4. Normal heart rates are cited in the previous vital signs section. Systolic heave may indicate right ventricular enlargement. Apical impulse that is not proper location for age may indicate cardiomyopathy, pneumothorax, or diaphragmatic hernia. Murmurs that do not fit the criteria for innocent murmurs may indicate a disease or disorder. So, sa abdomen naman, inspect the shape of the abdomen, inspect umbilicus. In infants, the abdomen is prominent in supine position. Umbilicus is pink with no discharge, odor, redness, or herniation. Cord should demonstrate 3 vessels, 2 arteries, and 1 vein. So, as abnormal findings naman is scaphoid, both shape is sunken with prominent rib cage. Abdomen may result from malnutrition or dehydration. Auscultate bowel sounds, palpate for masses and tenderness, palpate liver, palpate spleen, palpate kidneys, and also the bladder. So sa normal findings nila is normal bowel sounds occur every 10 to 30 seconds. They sound like clicks, gargles, or growls. Abdomen is soft to palpate. Liver is usually palpable 1 to 2 centimeter below the right costal margin in young children. The spleen tip may be palpable during inspiration. The tip of the right kidney may be palpable during inspiration. Bladder may be slightly palpable in infants and small children. So sa abnormal findings, marked peristaltic waves almost always indicate a pathologic process such as pyloric stenosis. Sa male genitalia naman, inspect penis and urina meatus. Sa normal findings, penis is normal size for age and no lesions are seen. Diaper rash, however, is a common finding in infants. So abnormal findings, an unretractable foreskin in a child older than 3 months suggests phimosis. Inspect and palpate scrotum and testes. Inspect and palpate inguinal area for hernias. Scrotum is free of lesion. Testes are palpable in scrotum with the left testile usually in lower than the right. No inguinal hernias are present. So sa abnormal findings, absent testiles and atrophic scrotum suggest true streptococcidism. This suggests that the textiles never descended. A blue in the inguinal area or palpation of a mass in the inguinal canal suggests an inguinal hernia. So sa female genitalia naman, inspect external genitalia. Labia majora and minora are pink and moist. Newborn's genitalia may appear prominent because of influence of material hormones. Sa abnormal findings, enlarged clitoris in newborns combined with fusion of the posterior labia majora suggests ambiguous genitalia. Sa anus and rectum, inspect the anus. The anal opening should be visible and moist. Sa abnormal findings, incorporate anus, no anal opening should be referred. Sa musculoskeletal, assess arms, hands, feet, and legs. Feet and legs are symmetric in size, shape, and movement. Short, broad extremities, hyperextensile joints, and palmar symmetries may indicate Down syndrome. Assess for congenital hip dysplasia. So, ito ay equal sa normal findings, equal gluteal folds and full hip abductions are normal findings. Sa abnormal findings, unequal gluteal folds are limited hip abduction are signs of congenital hip dysplasia. Assess spinal alignment. So, dapat in newborns, the spine is flexible with convex dorsal and sacral curve. Sa abnormal findings, in newborn, flaccid or rigid posture is considered abnormal. Assess the newborns and infants' cry, responsive, and adoption. So, the newborns and infant cries are lasting, strong, respond approximately to stimuli and quiet, soothing when held in face position. So, sa abnormal naman is an inappropriate response to stimuli suggests CNS disorders or problems. Test deep tendon and superficial reflexes, and also test motor function. Infantile reflexes are present when appropriate and are asymmetric. The Babinski response is normal in children younger than 2 years. Sa abnormal findings, absence or marked intensity of these reflexes, asymmetry, and presence of Babinski response after age 2 years may demonstrate pathology. So, next, as the reflexes illustrate and describe are the most commonly tested newborn reflexes. These reflexes are present in all normal newborns. Wait lang. And most disappear within a few months and after birth. Therefore, absence of reflex at birth or persistence of a reflex past a certain age may indicate a problem with central nervous system function. Sa routine reflex, to elicit the routine reflex, touch the newborn's upper or lower lip or cheek with a glove finger or sterile nipple. The newborn will move the head toward the stimulated area and open the mouth. So, yun yung routine reflex. So dapat malinis yung ilalagay natin sa upper or lower lip na patient. So, kung iba naman, dapat sterile. So, kapag na-sense nung infant na merong tayong nilagay sa kanilang labi, so okay yung kanilang routine reflex. So disappearance of reflex, the routine reflex disappears by 3 to 4 months. Sa abnormal findings, absence of a routine indicates serious CNS disease. Sucking reflex, place a glove finger or nipple in the newborn's mouth and note the strength of the sucking response. So titignan naman natin yung kung papaano dumede yung patient. So, the disappearance of reflex. This reflex disappears at 10 to 12 months. Abnormal findings, a weak or absent sucking reflex may be indicate a neurologic disorder, prematurity, or CNS depression caused by maternal drug use or medication during pregnancy. The palmar grasp reflex. Press your fingers against the palmar surface of the newborn hand. Ito. Hand from the ulnar side. Ay, kung makita yung aking ano. The grab should be strong. You may even be able to pull the newborn to a sitting position. Wala. The disappearance of reflex, this reflex disappears at 3 to 4 months. Abnormal findings, a diminished response usually indicates prematurity. No response suggests neurologic deficit. Asymmetric graph suggests fracture of the humerus or peripheral nerve damage. If this reflex persists past 4 months, cerebral dysfunction may be present. The plantar grasp reflex touch the ball of the newborn's foot. The two should be curled down tightly. Disappearance of reflex is 8 to 10 months. Abnormal findings, a diminished response usually indicates prematurity or response suggests neurologic deficit. The tonic neck reflex, the newborn should be supine, turn the head to one side with newborn's jaw at the shoulder. The tonic reflex is present when the arm and leg on the side to which the head is turned extend and the opposite arm and leg flex. So the disappearance of reflex is 46 months. The abnormal findings. If this reflex persists until later infancy, brain damage is usually present. The motor startle reflex, the motor reflex is a response to sudden stimulation or an abrupt change in position. And disappearance of reflex is by 3 months. Abnormal findings, asymmetric response suggests injury of the part that respond more slowly. Babinski reflex, hold the newborn's foot and stroke up the lateral edge and across the ball. Disappearance of reflex is within 2 years, and the abnormal findings is a positive response after 2 years suggests pyramidal tract disease. Stephen reflex, hold the newborn upright from behind to provide a support under the arms and let the newborn feet touch a surface. The disappearance of reflex is within 2 months, and the abnormal findings is an asymmetric response may indicate injury of the leg, CNS damage, or peripheral nerve injury. Okay na.
Done na?
Okay na. Tinanong ko na.